As a pharmacist, here are the most common mistakes that I see people make when they come to choose their over-the-counter cold and flu medication. The first mistake is looking at the front of the box instead of the drug facts label. The front of the boxes are really entertaining, and they say things like severe cold or nighttime cough that draw you to them and think, oh, that's probably the right product for my needs, but that's not where you should be looking. What you should be looking at is the drug facts label on the product. Now, there's two things to look for here. First are the names of the ingredients. But don't worry, you don't need to be a pharmacist. You don't need to know what all of these complicated chemicals mean, because right next to them, they're gonna have listed what they're for. So you wanna match the symptoms with the symptoms you're actually experiencing to help you choose a product that's actually going to treat the symptoms you have. Now, the second mistake I see people make is they choose the product with the most ingredients because they think that's gonna work the best. You don't want to take medication for symptoms that you don't have. It increases your risk of side effects, the medications can interact with prescriptions that you're taking, and they may not be the right thing based on the symptoms you have, whether it's a cold or a flu or something like that. So you always want to match the symptoms you have. You want to say about 2/3 at least of the symptoms on the box. That way you know it's going to be the right fit for your needs and you're not taking extra medication that you don't need. The third mistake that I see people make all the time is specific to treating a cough. Everyone thinks, oh, if I have a cough, I want to suppress it, I want to make it stop. But that's not always the case. If you have a wet, productive cough, that's your body trying to get rid of the virus or bacteria that's making you sick. It's a productive cough, so you want that stuff out of you. The best thing to do is to drink a lot of fluids or take an expectorant like guaifenesin. Those things are gonna help thin out the mucus, make the cough less annoying, but not prevent your body from getting rid of that invader in the mucus that it's trying to cough up. The only time you would really want to take a cough suppressant is if you have a dry, persistent cough or you have a wet cough that's keeping you up at night. That's gonna help you get some rest without being interrupted by coughing. Another common mistake I see people make is if they have a cough or chest congestion, anything that's sort of affecting their lungs, they feel like they need a liquid medication, that it's gonna coat their throat or soothe their lungs, but that's not the case. When you swallow a liquid, it goes to your stomach, not to your lungs, the same way that a tablet does. So both of these medications are going to be equally effective. And what's even more important to consider is that liquid medications often contain less number of doses and they cost more. So you're essentially wasting your money on a product that's going to work the same way as a tablet would. You really only need liquids if you have trouble swallowing tablets. This is another mistake, and this is particularly when it comes to the safety of your kids. I see a lot of adults that will purchase a children's medication and just cut it in half if their kid happens to be younger than the age on the box. Do not do this. If the medication doesn't have a dose for your child's age or weight, you should not give it to them. Talk to your pediatrician. They will tell you not only what medication is safe to use, but what dosage is safe. You shouldn't be trying to figure this out on your own without expert advice.